What if you could receive hospital-level care in your own home? With St. Luke's new care model offering state-of-the-art virtual technology and in-person hands-on care in the home, that's now a real possibility for some patients here in the Kansas City area. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about St. Luke's new Hospital in Your Home program, the first of its kind in the region. With me today is Dr. Michael Nassif, the Medical Director of St. Luke's Hospital in Your Home program. Thank you so much for joining us.
Thank you for having me.
So first, Dr. Nassif, St. Luke's is the first in the region to implement this type of program. Can you walk us through how Hospital in Your Home works from the patient's perspective?
Yeah, and so the way our average day works, so these patients are admitted either directly from the emergency room or sometimes they've spent a night in the hospital and we transition them home. But so when they are transitioned home, our team meets them in their home. Our team sets up all the technology. So we give them a tablet to be able to do video visits with us. We give them a phone that if they pick it up, it calls their RN directly. And we also give them a watch to wear that they can hit. And so they have 3 ways to contact us 24 hours a day. We answer within 10 seconds. Then likewise, we have some wearable technologies to monitor vital signs, weights, heart rhythm, pulse ox. It's a true hybrid model where we're combining in-person hands-on care with virtual visits. And so we are in the home twice a day, every day. We probably spend the average of 3 to 4 hours in the home with the patient. And then virtually the RN visits 4 times a day on average for over 2 hours per day. And then the physician, including general hospitalists as well as specialists, also do remote visits.
So what types of patients can use this new model?
Yes, I think the ideal patient is really patients who just require either IV therapies or constant monitoring or constant lab draws. We use the St. Luke's East inpatient pharmacy, so we have access to all of the pharmacy meds that they give in the hospital. We use the St. Luke's inpatient labs. We have access to the exact same laboratory testing, and we can do stat medication, stat labs. We can do imaging in the home. We think for patients on typical medical or surgery floors, we can provide 99% of the care they would get in the brick and mortar hospital in the home. The patients thus far that we've been enrolling the most are patients with chronic conditions such as congestive heart failure or chronic obstructive pulmonary disease, people with chronic bronchitis and pneumonias. And it's really, these patients have had this condition for decades, but are having an acute exacerbation or flare. And by leaving them in their home, they get better rest at night. They don't have as much issues with deconditioning by being in bed all day. And often our average age patient is almost 80. And often these are the patients that do very poorly in the hospital.
So how is this program different than home health?
Yeah, that's a common misconception. So these patients are acutely ill. By definition, they couldn't be treated as an outpatient. And so these patients have to have met a criteria to be admitted to the hospital. It's actually when we first get engaged. Home health is typically for patients when they're finished with their hospitalization, and home health usually has a nurse checking in once or twice a week. In this case, so our team is in person twice a day. We have a nurse practitioner as well in the home every other day for 90 minutes. Our nurses on average are spending about 2 hours of FaceTime with the patient every single day. Likewise, we can provide physical therapy, occupational therapy, x-rays, ultrasounds. This is true hospital level care. It's just we've created the infrastructure to bring this to patients in their home.
Now, if I'm a patient utilizing this program at home, how do I keep that connection or relationship with my physicians and nurses like I would in the hospital? Explain how that interaction works.
Yeah, no, and it's actually been kind of amazing for me to see because, I was worried we'd lose a little bit of that with the virtual care, but it's been exactly the opposite because I think we spend so much more time with the patient. And likewise, we're in their actual home. We go through their pantries to help them choose appropriate meals. We're actually able to supply meals, but we meet the patients in many instances. We meet their daughters and sons and granddaughters, and we get to know their family and their support structure. Our patient satisfaction has been incredibly high so far.
Well, that's great. So many patients with these chronic types of conditions return to the hospital multiple times traditionally. How will this program help reduce readmissions for these types of patients?
Yeah, and so that's one of our big goals. Is as you alluded to, the major 5 reasons for hospitalization: heart failure, COPD, pneumonia, heart attacks, and hip and joint replacements have about a 25% 1-month readmission rate. And our goal is to more than cut that in half. And so it's very early. We've treated 19 patients to date, and we've only been live for 1 month, but thus far we've had no readmissions. And I think part of it is that we are able to spend so much more time with the patients. And I also think the patients just heal so much better by getting a good night's rest and staying active during the day as opposed to in the brick and mortar hospital.
What's your final message to patients or family members of patients who might be able to use this new model?
Yeah, I think a couple of things. Some patients are a little nervous about the technology, and we try to reassure them that, one, it's very easy to use, but also this is a true hybrid. So we will be in their home at a minimum of 2 times a day, but oftentimes we'll be there 3, 4, or 5 times a day. So while there is some virtual visits and remote monitoring, there's also in-person hands-on care. So we're there to help them if they do have any trouble with any of the technology aspects. The other thing, I'd say is, it's been kind of incredible so far to see how much more education you can do with the patients. And, we say that you don't truly know your patient until you've seen their home. And we've gone through patients' pantries and helped them select, more heart healthy and meals. We're able to supply meals. And likewise, it's a much better opportunity in the brick and mortar hospital. I often have 20 minutes a day where I'm free to stop by the patient, but in the hospital in your home, we're available by video all day long. So we meet caregivers, we meet daughters, we meet granddaughters. The patients also really enjoy, we give them a daily schedule, so they know exactly what time the nurse is going to check in, the physical therapist is going to come by, and the physician is going to come by. And so I think for the right patient, it truly is a superior care model.
Okay, great. Well, thank you so much for joining us.
Yeah, thank you.
To learn more about St. Luke's Hospital in Your Home program, visit stlukeskc.org/home-hospital. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.